Sawro's main mission to serve the marginalized immigrant women so then they can get full participant equally in the Canadian society, civic and social life. And we are working together to achieve the leadership for the community's women so they can deploy and activate at all level of the organization in Sawro and also activate in the community. Since the beginning, Sawro has supporting the community women to build their leadership skills, to become civically engaged and participate in democratic process. So this including supporting community women to lead conversation and mobilizations on issues that they affect every time. And this has been ongoing since 2008. So we are the organization that raised the community's concern that how we get totally excluded from the society and how the marginalization impacting us. So since 2008, when we're working to raise the community's leadership and same times we try to let other people understand the community's concern, we have been working with different stakeholders and different time to raise the concern. Our main issue is like our community's people totally impacted by the precariously employment concern and feel so disadvantaged in the labor market, feel so disadvantaged in their voice, in the political platform or decision-making platform. So during the pandemic period, from the beginning of the pandemic, we started to raise the community's concern in the different stakeholders and giving them the understand how important to centralize the racialized immigrant women's issue and how important to listen to us and change the policy and program and practices based on our need. That we started from eve of the pandemic to March 2020. And in the middle of the pandemic, we did another survey. We showed that how the impact is very complex and very severe to the racialized, especially South Asian women, especially more in Bangladeshi immigrant women in our serving catchment area. So we really want to influence the political process. And we really want to let other person understand, give us the opinion, give us the space for our community's leadership can be presented in here. So we work with McMaster University, and here you see the Stephanie Premji with us. She is also working with another project that is really kind of information giving to the community that how the invisible injury of the workers impact their family, impact their life, and how it gets neglected by the community, decision-making authority, how it's neglected by the policy and program. So I would like to, I'm not going to make it so big because today I'm not going to speak. Speaking part is going to be done by the community's women leader who tirelessly working on the issue and bringing everything to present on you, their lived experience. But I'm going to introduce Stephanie and request Stephanie, please say something about your opening remarks that when you work in this community, like what is your experience, and then we can start the presentation. Just one thing, sir, before you start, I just want to say that whole things we are putting in here, let the women speak first, those who are going to do the presentation of each of the issue. Then we're going to give the opportunity to the political candidates for each of the party to talk. And then we're going to bring some question here. So please help us to run this all-candidate forum very inclusive and very successfully. I need everybody's help. Thank you. Stephanie, you can talk right now. Sorry.
Thank you so much, Sultana. So my name is Stephanie Premji, and I'm an associate professor at the School of Labor Studies at McMaster University. And I've been working with Sawro for a number of years now. Originally, we worked together to develop a community workshop on health and safety and access to workers' compensation. And for the past couple of years, we have been working together on a community engaged research project, which is titled Working and Hurting in Little Bangladesh. And what we've been doing is documenting experiences of precarious work, of work injuries and illnesses, and access to the WSIB and return to work. And we'll present the results of our study in a little bit. But what I want to say at this point is that the issues of precarious work and how it impacts health and safety are long-standing issues. I've been doing research in this area for 20 years. And really nothing has changed on these fronts, except that things have actually gotten worse for the people who are working in factories and in low-wage service jobs and other low-wage sectors. And we know that employment precarity is becoming more and more common. It's actually the norm now in the GTA. And we also know that those who are most likely to be impacted are racialized men and women, but women in particular, because of the jobs that they're in, and also because of other factors, such as their disproportionate responsibility for childcare. And the impact has really been devastating for workers, for families, for communities. One of the things that has really become apparent is the intergenerational impact of this trauma on young people. And we see this in very high rates of mental health issues among racialized youth. So it's not often that we as academics have the opportunity to have a dialogue with politicians. And this is why we do this type of community engaged research, to really do research that reflects and addresses the needs of the community. So we look forward to sharing our findings and also hearing from you about what you can do to make life a little bit easier for the most vulnerable. We've been advocating for action for many, many years. And the lack of political movement on these issues has really been disheartening. Without going further into this, I will send this back to Sultana, who will introduce our first speaker.
Thank you, Stephanie. As I said before, that the very beginning of the pandemic, we started the consultation to define face-to-face understand the multidimensional impact. Our understanding of immediate concerns and the need for change in the recovery phase of the pandemic comes from a recent consultation that we do with 171 low-income and precariously employed immigrant women, youth and senior from our community to discuss employment, income support, benefit, health, housing, childcare, and gender-based violence through survey and focus groups. So we are going to bring the community's concern and community's recommendation right now to do the presentation. So I would like to request Patichi Sarkar to start with this presentation. So, and let us know that what is the community's concern and what is the community's lived experience regarding all of this issue. So please welcome Patichi Sarkar.
Thank you, everyone. Good evening. My name is Ratichi, and I'm one of the community leaders working with Sawro for the last several years. And recently, I was involved in facilitating focus groups for a study that was mentioned by Sultana previously. So, through the survey and the several focus group discussions with the community's women, we determined that there was a clear consensus among these women regarding their working conditions. They strongly vocalized that precarious and underemployment had been major concerns for several years, and it only further deteriorated during the pandemic as there was a lack of workplace protections for this group, hence increasing the vulnerability during the global crisis. While workers are impacted by the onset, all workers are impacted by the onset of the pandemic. Workers employed in low wage and precarious employment in a wide range of low-skilled occupations were the first to face work interruptions and significant income loss. So I would like to share some of the key concerns that were raised by those focus group participants just shortly. So to begin, there was, as you may have heard, there was a lots of mass layoffs during the pandemic, especially for workers employed through temporary help agencies in sectors such as manufacturing, food services, and childcare sectors. These are occupations where a majority of the community's members in Scarborough Southwest, as well as Beaches Eastward, these community members were employed in such sectors. This resulted in significant economic hardships in the community for long periods of time during the pandemic. Participants also confirmed that temporary help agencies, THAs, continue to be a significant concern as their ability to follow employment laws were neglected. For those who were able to work during the pandemic, yet due to the limitation of the nature of their work, many could not work from home due to lack of resources, or they simply did not even have the opportunity to work from home. Concerns regarding workplace behavior, including predatory work practices, such as understaffing workplaces, calling in employees on a short notice, scheduling odd hours throughout the week with disregard of employees' health needs, and as well as the failure to ensure adequate PPE and social distancing in workplaces were also reported by these participants. One of the most substantial concern raised during the focus group discussions from these low-wage worker participants was that the current minimum wage fails to provide for their basic needs, especially with the recent rise in inflation. And with regards to the working environment during the pandemic, participants felt that the low-wage workplaces did not adequately meet the health and safety standards set out by the local public health officials. This has resulted in multiple workplace exposures and outbreaks of COVID-19. In other cases, participants had no other choice other than to work in high-risk work settings or had to conduct a risk assessment for COVID-19 exposure. And lastly, participants were working mothers were pressed with household responsibilities, such as caregiving for their younger children. And with schools and daycare shut down during the pandemic, many were forced to voluntarily quit the workforce, hence resulting in their exclusion from work-related social benefits. With these concerns in mind, there needs to be a feminist and equity-based pandemic recovery response to address labor market challenges in order for all worker rights and dignity to be recognized at their workplace. The community members demanded the following to rectify the concerns raised during the focus groups. So first, there needs to be a call for public inquiry into underemployment, which contributes to de-skilling of skilled immigrant women, to identify the cause and inadequacies and gaps in existing programs and policies, and develop practical remediation of policy and programs going forward. Also, Bill 124 needs to be eliminated while implementing a living wage and a multi-year plan to see a regular increase for low-wage sector workers with respect to the rising inflation. The protection of vulnerable workers needs to be amended into the labor and employment laws as well. Protection measures include paid sick leave, disincentivizing of employers for chaotic work scheduling, and third-party representation for non-unionized workers. There also needs to be restricted scope of operations for THAs, as in temporary help agencies. This includes licensing and bonding THAs participating in unfair work practices, restricting the percentage of workers in an enterprise who are THA assignment workers while carrying out forensic audits on workplace rights. Therefore, the workplace rights and dignity of temporary assignment workers are being held up. There also needs to be the creation and protection of full-time jobs, as in 40 hours a week jobs with benefits in the low-wage sectors, such as manufacturing, fast food, hospitality. And there needs to be legislation that needs to be passed to restrict and penalize employers for the implementation of predatory work and scheduling practices, and to protect employees from such practices. Employers and workplaces also need to adhere to the action plan set out by the City of Toronto, or even as well as the Ontario medical officers with regards to workplace COVID-19 protocols. And lastly, the government and as in both the provincial and the federal government should prioritize the growth of stable full-time jobs in sectors that support the immediate and long-term needs of the society. So these sectors include health, social services, as well as education. I'd like to thank all the candidates for listening, and I'd like to now pass it along to my colleague. Thank you.
Thank you, Pratiti, and thank you all the candidates for coming and sharing your political or your party's platform today. So my name is Mahima, and I have been involved with Sawro since 2007 as a youth leader and now as a young woman activist. So to start off, I want to say that the state of our safety nets has been in a dire state for many years, even before the pandemic. So do you mind going to the next slide? Okay, so many Ontarians and their families are constantly being pushed into poverty due to low wages, rising cost of living, inequities in society, and the labor market that affects Black, Indigenous, and people of color, as well as immigrant women and youth, and other unforeseen circumstances, such as the COVID-19 global crisis and other form of crises, have been pushing these populations into lower wages. So this is forcing people to make challenging choices between paying their rent and their bills and buying food. So government at all levels recognize the need to modernize safety nets. While there are some efforts to increase access to safety nets during COVID-19, this was virtually non-existent for our province. There was no discussion about making provincial safety nets such as OW, ODSP, and work-related programs such as WSIB livable and accessible during the pandemic. The rates were not only stuck at arbitrarily low rates that are far below the provincial low income cutoff rate, which was set at 50,000 in 2022, recipients also faced cutbacks and other penalties for accessing other supports. So as per MAP Center for Urban Health Solutions open letter, the amount of money provided to cover basic needs such as food and shelter is not reflective of the increasing cost of living in Ontario, particularly in Toronto. So during our consultations, low-income and precariously employed immigrant women pointed to the inadequacy of safety nets, especially the Provincial Social Assistance Program. They also expressed frustrations about the lack of cohesive understanding about poverty from all levels of government and the lack of collaboration between all levels of government to modernize the safety nets. With regards to the provincial safety nets, participants mentioned the following key concerns. One, individuals with temporary and precarious immigration status, such as international students or temporary foreign workers, fell through exclusionary criteria. They were excluded from regular work-related benefits and public income support programs, despite ongoing contributions to the program. Low-income immigrant seniors were excluded from any age-related benefits due to exclusionary criteria regarding their length of stay and sponsorship status. Two, many could not access the income supports and benefits due to the lack of information, as well as technological and language barriers. Three, many also felt that the benefits amounts were not enough to meet families' basic expenses. According to our survey statistics, over 50% reported that income supports were not enough to meet their families' basic needs. This was especially the case for women fleeing domestic violence who found it difficult to support their families or their children. Four, recipients of OW and ODSP faced continued clawbacks, especially when they accessed other social benefits. In addition, families that were on social assistance reported clawbacks due to their children's income. So social assistant workers counted children's income as a part of their income. However, the earnings made by the children were mainly to spend for the tuition and other post-secondary costs. So this situation points to a lack of inclusion of community voices in policy decision-making. We need a modernized provincial safety net to meet the current realities. This includes increasing rates for provincial social assistance to meet basic living expenses and the needs to take into account the rising cost of food, rent, and medicine. The amount should also be adjusted with inflation. Reviewing eligibilities to ensure those who have been excluded based on the work arrangement, financial status, immigration status, etc., are also able to access social assistance. We also recommend ending policies that discourage OW and ODSP recipients from employment, such as clawbacks and penalties, and implementing measures that are friendly to recipients and support them in a dignified way. We also recommend increasing and providing tailored supports for people accessing social assistance based on their circumstances and needs. This is especially important for women and youth leaving violence. And finally, we recommend collaboration between all levels of government to modernize safety nets. Thank you. So I'm just going to pass it on to Mumtaz right now. Yeah.
So I will actually just speak before Mumtaz, just to give a little bit of an introduction to the project, if that's okay. And I'm just going to go ahead and share my screen.
Yeah, it's okay. It's okay.
Okay, perfect. Let me just see here. Okay. As I mentioned earlier, I've been working with Sawro on a research project that has been conducted by a really amazing group of women, including Mumtaz Begum, Kishwar Leila, Fabia Tassin, and of course, Sultana. And my role in this project is really to help guide the project, but I do want to say that the ownership of the project is truly theirs. So we recently released our draft report, which I believe has been shared with the candidates who are present today. If not, I'm happy to do that after the forum. But as I mentioned, we documented experiences of precarious work in health and safety. And we began the project as the pandemic began in the spring of 2020. And we also documented the impact of the pandemic on the workers that we spoke with. We conducted 31 interviews, we conducted focus groups, and we also spoke to key informants who have knowledge of community issues and can talk about the larger trends. One interesting to note about our study, and this is a really important point, is that 89% of the workers that we spoke with had a post-secondary education. And this is also something that we found in other studies, that the problems that we're documenting have nothing to do with lack of human capital. It's not a problem of lack of education. It's not a recent immigrant problem. It's really a problem with the system, not the individuals who are highly educated, hardworking, and in many cases have been in Canada for years and years. So what did our study find? And I'll just begin with a quote from one of the workers that we spoke to. In some instances, say I would be working at a factory for 7 days straight. So I went to work as usual, and they said there's no more work starting tomorrow, which means they knew from the beginning that the job was only going to last a few days. In the meantime, I could get calls from other agencies to do their job, but I would refuse because of this job. Then suddenly one afternoon, they would call us and say, you have work at night, but we're forced to take it, right? So this quote illustrates the temporary nature of the work, its unpredictability, the non-standard schedules that workers have to accept, and overall the lack of power that workers experience in the labor market and in the workplace. We can speak about what we call intentional precarity, whereby really we're talking about the system being set up in such a way as to maintain this so-called docile workforce that has no other options but to accept these poor working conditions. And in fact, employers get quite creative in finding ways to do this and to maintain workers in this situation of precarity. And the other important point is that the policy and the regulatory framework allows this precarity and in fact amplifies this precarity. So what did we find specifically in our study? You know, a lot of what we found has already been said. And this really reflects the fact that the lack of action on these issues has nothing to do with lack of knowledge. We have the knowledge, we've had this knowledge. So we found very similar results as what we just heard, that workers experience multiple forms of precarity. First, they experience employment precarity, with most working in casual on-call jobs through temporary employment agencies. And because of this, workers were often forced to take on multiple jobs. And even those who were full-time permanent workers experienced precarity because, for example, they could see their hours reduced or their employment terminated at any time. They also experienced scheduling precarity, as we've heard. So workers reported extremely irregular work hours, with most of them having on-call jobs. And they really explained that it was challenging to have a decent human life because they needed to be available 24/7. And workers found this practice abusive and dehumanizing. And it's particularly difficult for women because of their gendered responsibilities for household and childcare. Workers also experience wage precarity. Most of the workers we spoke to received minimum wage, and their wages typically did not increase over time. And when the wages increased, they increased by ridiculously small amounts. And this is especially concerning because, as you know, inflation is increasing, which includes the cost of food and rent. And this wage precarity was also felt by workers because they experienced significant amounts of wage theft and wage loss. For example, through practices such as unpaid regular time or overtime, and because of temporary agencies deducting amounts from their pay for various reasons. Another type of precarity has to do with a lack of government benefits. Workers didn't have access to any type of employer-sponsored or government benefits. Most reported having no paid sick leaves. And as you know, Ontario does not have a permanent paid sick leave program. And when no work means no income, workers felt that being sick wasn't an option for them, even though one doesn't have a choice in being sick or not. And they were afraid to even ask for unpaid time off work because they thought that this would jeopardize their employment. And there are other examples of, not being eligible for EI benefits, sometimes because of lack of documented hours or because they were misclassified as independent contractors. And as we've heard with the previous speakers, the pandemic has really made things worse for workers. And during the various waves of the pandemic, workers transitioned in and out of employment in response to different external conditions, and largely in jobs that were deemed essential. And workers report that their jobs became more intense and more precarious over the course of the pandemic. Many of them moved into more precarious forms of employment, such as gig work or on-call work, or they experience intermittent employment or a reduction in their work hours. So it's important to note that at the same time, the jobs that workers held during the pandemic were not subject to pay increases, despite the additional risk that they faced and the additional cost that they had to shoulder, such as having to buy personal protective equipment. And also the cost of having to take time off to isolate, to recover, to get tested or vaccinated. So our report includes many recommendations, and again, this reflects what we've already heard, that we need to stop incentivizing hiring through temporary agencies. For example, by closing the current regulatory loophole that absolves employers who hire through temp agency of the responsibility for work injuries and illnesses. So employers will typically hire through temp agencies for jobs that are particularly dangerous for that reason. And another example is putting in place restrictions on the proportion of employees who can be hired through temp agencies, and to impose financial penalties on employers who fail to adhere to restrictions. But these are just a few of many recommendations that we have on many different aspects of what we found. To present some of our other findings, I will now pass it over to Momtaz Begum, who is the coordinator of our project.
I believe Mamtas isn't here, but maybe Fabia can go on.
Yes, maybe Fabia, you can go ahead. I think Momtaz was experiencing some computer issues, so I think she's trying to reconnect.
Yeah, that sounds good. So I will be just sharing my screen. Sorry, just give me 1 second. Can you guys see it? Okay, so today I will be talking about the Workplace Safety and Insurance Board. And before I start my presentation, I just want to read out loud a quote from one of our worker interviews, which reflects the issue of claim suppression in precarious sectors. I was working through the agency I knew from before about the WSIB, but here, when I mentioned WSIB, they got very triggered. When I applied to the WSIB, I don't remember if I did it or if my doctor told me to do it, but when I told them, so the form wants to know from the employer how the employee fell down, they said, I purposely fell down. After resting for about 2 weeks, the WSIB gave me a letter saying that my claim was denied. They said my employer would know the reason. After 2 weeks, when I went to work, they called me in. The lady told me, you fell down on purpose, didn't you? I stared at her. I told her if I wanted to fall, would I fall like that with my knees and elbows bent? My whole body was shaking. Okay, so analysis of worker testimonies found that for a multitude of reasons, workers delay or abstain from reporting their injury to WSIB and from seeking benefits. So first of all, the role of WSIB is to provide compensation and benefits for work-related injury and illness, including healthcare coverage and loss of earnings benefit. From analyzing the data collected for our research project, we found that for Bangladeshi workers in our community who have experiences with work-related injury and illness, they are unlikely to seek out any form of compensation, benefits, or social support from WSIB post-injury. And for those that do, they find that their claims tend to get rejected on the basis of some arbitrary clauses or reasons that are unclear. So we wonder, why is that? How come even in the face of debilitating and potentially life-threatening injuries, do workers not seek compensation? It turns out that WSIB as an institution and the claims process is severely broken. It is not functioning as it should in assisting workers with the recovery and return to work process. Rather, there are various factors in place that suppress and minimize worker injuries, their rights, and their entitlement in such cases. First of all, it was found that workers have a significant lack of awareness and background knowledge on WSIB and the complicated process of filing a claim. Even though some workers had a vague and general idea on WSIB and its role, they found that the claims process was too long and complex. It is especially daunting process for Bangladeshi workers who are often newcomers with limited proficiency in English and computer skills and other technical knowledge and know-how, and face several other barriers which make it all the more difficult to navigate the complex claims process. Secondly, employers actively engage in suppression of claims by adopting several harassing and scare tactics, which includes putting pressure on workers to come back too early. It was found that because employers were reluctant in reporting injuries and providing benefits through WSIB, they resort to various tactics to inspire workers from refraining from making a claim, causing waves, and to come back to work before they have even recovered and are ready to do so. Employers often verbally abused and coerced workers to join work, citing staffing shortages. and workers were compelled to listen as if feared retaliation from employers and hoped to maintain a good standing with them. As a result, they resumed working before their injury had even subsided, so they cracked under the fear and the pressure and did not receive any compensation for the days missed due to injury. An overall culture of suspicion and denial that dehumanizes and minimizes worker injury. From the data that we gathered for a project, there was a clear consensus that workers, whenever they experienced any type of workplace injury or illness, they faced a lot of scrutiny from not only the employer, but doctors and also WSIB as a whole. It seemed that there was a preconceived notion that workers are lying about the way they got hurt or maybe the severity of their injuries. And all of their conditions and their testimonies were heavily dissected, and it was found that most of them were kind of arbitrarily rejected. And because of this tendency of the establishment to advocate for not the worker interest, but the interests of the employers, and to protect the bottom line of employers, workers were discouraged from making a claim when they deemed that their condition was not severe enough. So they sat out and continued to work or went back to work early when they were not fit to do so. Furthermore, pre-existing precarious economic conditions compelled workers to refrain from seeking compensation on their own. Workers making minimum wages and are already struggling to make ends meet and simply do not have the time or the resources to go through with the lengthy and time-consuming and the mentally taxing process of the claims process, as well as the appeals, which often take up to years. And for a worker who's making minimum wage, it is not worth it for them to fight tooth and nail to receive 80% of their income, which is not enough at all to make ends meet, especially in an expensive city such as Toronto. And we all know Scarborough Southwest, the rents are significantly high and the living cost is exuberant. So it doesn't make sense for people to do that, which further acts as a barrier. So because of these issues, our team came up with some recommendations in order to fix this broken system. Number one would be to ensure that WSIB policies and practices account for the reality of precarious employment to guarantee fair access to benefits and services. Number two, addressing barriers to reporting and claim filing, including claim suppression strategies by employers and a complicated and lengthy WSIB process. Number three, increase the WSIB income replacement rate to 100% for minimum wage workers, because 80% of minimum wage is simply not livable income. That's it for me. I'm going to pass it on to the next person. Thank you.
Hi, everyone. Can you hear me?
Yes, we can hear you.
Okay, I'm not sure if I'm able to share my screen.
Okay, 1 second, 1 second only. Mumtaz, we're going to come back to you again, but we just want to go back to some of our presentation, then we're going to bring it back.
Sure,
okay.
That works. Thank you.
So I'm just requesting the proceed the next person, please.
I think that would be me. I'll be presenting the section on health and safety. Okay, I think my screen is showing good. So I'll just be touching on health and safety and what we gathered from our survey results and our consultations. Just starting off, I want to say that although COVID-19 has put a spotlight on the disproportionately negative health outcomes faced by racialized and immigrant communities, these health disparities existed long before the pandemic. And the social determinants of health, such as income and employment, as touched on earlier by Stephanie, along with inadequate housing, health literacy, and healthcare access, they have largely contributed to these gaps. And racialized and newcomer populations, for example, are less likely to have a regular primary care physician. They're less likely to have access to quality and culturally sensitive healthcare. And these factors have contributed to higher rates of chronic health conditions in immigrant and low-income communities, which is actually reflected in that pie chart we have there as well, based on our survey results. And these chronic health conditions have actually increased their vulnerability to negative COVID-19 health outcomes. And the impacts of these social determinants became even more pronounced during the COVID-19 pandemic as the health of members from marginalized communities became compromised due to the lack of adequate health and safety measures in their workplaces and communities. Additionally, the economic implications of this pandemic, such as increased financial and job precarity, has further exacerbated these health disparities, including mental health impacts, by significantly impacting members of racialized and immigrant populations who are already struggling with affording just basic needs such as groceries and housing. And in fact, according to the Institute Clinical Evaluative Science report regarding testing and positivity rates in Ontario, although immigrants and other newcomers make up over 25% of the Ontario population, they accounted for 43.5% of all COVID-19 cases. In our own survey, 73.3% of participants reported a COVID-19 infection at some point. That's significant. And this indicates that COVID-19 is primarily affecting newcomer populations who are likely to be financially disadvantaged and live in overcrowded housing. And health and safety, which has always been compromised in workplaces that frequently employ newcomers, became even more precarious during the pandemic and exposed workers to frequent outbreaks. And of course, this is compounded by immigrant and racialized populations' overall lack of access to health and medical supports, such as COVID-19 testing, as well as primary health care and emergency services. We are still in the midst of dealing with the impacts of this pandemic, and COVID-19 has served to highlight the contributions of social and economic inequalities to housing and economic inequalities to health. And addressing these factors will require a multidimensional approach from all levels of government, done in close consultation with the impacted communities themselves. So just as highlighted during some of the context that I provided, our key concerns include inadequate health and safety regulations in the workplace, significant mental health impacts and lack of mental health supports, and limited healthcare resources. And on the next slide, I've highlighted some of our recommendations, which call for improved access and quality of healthcare services. Sorry, it's not on the next slide, it's on the side, but I'll just expand on what I mean by that. By improved access and quality of healthcare services, as well as addressing the social determinants of health. This can be done by, for example, increasing the number of practicing physicians, such as increasing spots in medical school and recognizing the credentials of immigrant doctors and residency matching. Physicians should also be educated on the specific health concerns of immigrant and racialized communities. And again, as mentioned, there is a mental health epidemic in immigrant communities, and that also needs to be addressed by establishing more affordable, accessible, and culturally sensitive mental health services. Of course, there must be also increased accessibility of COVID-19 resources specifically, such as including more testing options. This could involve mobile testing, and increasing vaccine distribution to at-risk areas or hotspots, as well as expanding COVID-19 testing eligibility. Now, of course, along with improving healthcare access and quality, I hope I've emphasized just how important these social determinants are in influencing our health outcomes, and they can be addressed by securing funding to house those who cannot safely quarantine in their homes, implementing more government regulation of health and safety practices in the workplace, and implementing medication subsidy programs that are accessible to low-income families regardless of their health needs. And addressing all of these factors, like I mentioned, will require consultation with the impacted communities themselves to really get an understanding of the barriers that they face. And yeah, this would conclude my portion of the presentation. Thank you so much to the candidates for listening. And I will hand it off to the next person. I believe it should be Kishore, who's going to talk about housing.
Thank you, Noor. Thank you very much. And thank you all candidates for joining this forum to listen to the community needs. My name is Kishore Laila, Community Women Leader, working with Sawro last more than 6 years. So I will be giving you the overview of housing situation with key concerns and recommendations came from community consultation. Right to accessible housing has been a long-standing issue for low-income racialized immigrant women, and it took a pandemic to expose the severity of the crisis. Through that consultation surveys found that community people, especially immigrant women who are precariously employed, are not able to afford the skyrocketing rent and need to worry about basic sustenance, as a huge chunk of their wages goes into paying the rent or other expenses. While these concerns have been raised prior to the pandemic, the COVID crisis brought about a lack of proper and accessible housing, ending into a health and safety issue, as many were unable to follow the COVID-19 health protocol. In the consultation, we offered the community of women to voice their concerns about living in insecure, unaffordable housing arrangements for their families in Toronto. So during the pandemic, office, school, and daycare were closed, and all on a sudden, households became overcrowded with no extra space for COVID-infected family members. As a result, many families contracted the infection. There was also paucity of space for special needs children and elderly family members. So in surveys found that 76% of participants out of 101 are living in rented house right now. And among them, 46 are paying $1,200 to $2,000 plus per month. So no one received any rent assistance from the government or from landlords as well. 56% mentioned landlord didn't cooperate with them during the pandemic at all. So we found that many were unable to access COVID-related social benefits on account of irregular working hours and income. This further impacted their ability to pay rent and meet basic expenditure. Landlords didn't adhere to the state mandate rent freezing. Participants reported that during the pandemic, landlord and apartment authority resorted to unethical practices to evacuate existing tenants and increase the rent for new tenants. To avoid any community backlashes and chaos, owners purposely conducted the eviction at night, leaving the tenant to fend for themselves. Those with precarious immigration status, like international students, refugee claimants, or non-status women, were forced to live under unhygienic and poor conditions. So we got some recommendations through the consultations, like government should impose a cap on rent based consumer price index and equalize the same for existing and new tenants. Focus on increasing access to social housing for low-income families rather than just affordable housing, and also reduce the wait times. The government must intervene to conduct regular inspection into rentals to ensure safety of tenants and safeguard them from predatory practices. Ensure equitable access to housing, subsidies, and rent assistance from the government in times of crisis like the COVID-19 pandemic. And mandating a freezing of rents as a disaster management and preparedness response, like in the case of the ongoing pandemic crisis. So in the end, I would like to mention again that our demand is to set up a cap on rent based on income and living expenses and build more social housing. Thank you so much. And now I guess Shauna Tyagi, I am passing to Shauna to give her a theme-based discussion. Thank you.
Thank you so much, Kishwar. So good evening, everyone. My name is Swarna Tyagi, and I'm working as a project coordinator with Sawro to address gender-based violence in the community. And I'm also doing my placement with Sawro as part of my master's in social work at University of Toronto. So today I will be presenting the key concerns and recommendations from the community women on issues of childcare and gender-based violence. So when it comes to accessible childcare, majority of immigrant women living in East Stanford neighborhoods of Toronto have been struggling to access affordable and quality childcare. Over the years, community women have been very vocal about this critical gap that has dissuaded many from being gainfully employed. This continues to be a significant barrier that many racialized immigrant women in Canada face. And we at Sawro have been advocating for community women and who have long been involved in advocating for childcare that is accessible to low-income families and precariously employed parents. Despite collective efforts, time and again, we've seen that the needs of low-income and precariously employed immigrant women are being tabled, even though they are the backbone of our economy. Systemic barriers faced by racialized immigrant women are often compounded by policies that do not recognize their intersectional needs. And this structural exclusion has been the case even prior to the pandemic. Even though the average $10 a day childcare fee was introduced for many, as mandated by the federal government, we must recognize that it is still affordable for many low-income families. From the community consultation that was conducted by Sawro, it is evident that many under-resourced community women are unable to make upfront childcare payments, which further undermines their ability in accessing quality daycare. This current plan also does not take into account the needs and realities of low-income caregivers and their right to quality and accessible and affordable childcare. Therefore, we must ensure that our new system's approach to affordability of childcare is equitable. Women are disproportionately dropping out of the labor force, and a fully funded childcare subsidy for low-income women is the only pathway for a feminist recovery. So Sawro women leaders also spoke to community women about their concerns regarding caregiving and access to childcare, especially during the pandemic. And it was seen that out of 101 women who were surveyed, majority were predominantly caregivers. And they mentioned that online schooling caused increased caregiving responsibilities. And they also mentioned not having the tools, the necessary tools and support needed for online schooling. Another issue that came to light during the pandemic was that most daycares were closed, and because of the government imposed lockdown, which really led to many women not being able to stay employed. Many also reported that lack of childcare subsidies impacted their employment, as almost half of the women from the survey had to leave their job voluntarily. 92% of the participants from the survey reported that their household responsibilities had significantly increased during the pandemic. Community women also revealed that they were not often supported by their families, their spouses, and the burden of caregiving solely fell on them. Also, 87% of the participants reported feeling very dissatisfied with the government's efforts to really address the needs of the caregivers during the pandemic. Several participants also expressed that following safety precautions like ensuring that their kids are constantly masking, washing hands, buying hygiene products, rapid antigen test kits, really heavily weighed on their finances. Women were also constantly worried of affecting their children because of the nature of the virus, resulting in paranoia and anxiety. Participants pointed out that online schooling, coupled with their husbands working from home, they were now burdened with additional household responsibility, leaving no time for self-care. So the women in the community consultations also came up with several recommendations, and some of them included, many said that it was important for the government to deliver on the long promised national universal childcare and ensure daycare subsidies for low-income women, especially those who tend to be homebound and are financially dependent on their husbands. Participants also noted the critical need to revise subsidy eligibility criteria to accommodate precariously employed caregivers. It is also essential to take into consideration caregivers who work irregular hours and develop childcare services that can specifically cater to their needs. Sawro has been vocal about ending staffing of childcare centers through the temporary help agencies. Community women also urged the government to account for labor involved in caregiving and allot childcare subsidies to homebound women to offset the cost of staying at home. Now, I would like to move on to gender-based violence. So coming to GBV, we came across many women in the community consultations that were faced with different forms of violence, including spousal, familial, physical, financial, emotional, psychological, and structural. GBV significantly impacts racialized immigrant women in Canada and is a growing concern for women in low-income communities, owing to systemic barriers that hinder their capability to seek help and access healthcare and social benefits to safeguard themselves. Even though GBV has existed prior to the pandemic with experiences of gender inequity pervading across social strata, for low-income racialized women, this has exacerbated during the pandemic, owing to interlocking and systemic barriers faced by the community. As a representative of the racialized immigrant community in East Stanford, Sawro has been privy to many instances of harm inflicted on community women and therefore decided to capture their lived experiences through the community consultation. through the community consultation, it was found that many women were unable to access pandemic-related social benefits and were excluded from the government's recovery policies and programs due to their status in the labor market. So some of the key concerns, again, I would like to highlight that came to the fore during Sawro's discussion with the women, included experiences of familial conflicts wherein women were often targeted and blamed by their spouses. Women also reported facing discrimination and abuse at workplace where their managers treated them unfairly, often passing racist comments. Their requests and needs, especially during the pandemic, were met with inconsideration and apathy. Many participants experienced discrimination by their employer on the basis of their race, ethnicity, and culture. Several precariously employed women were constantly threatened by the employer and forced to work irregular hours. Women also reported feeling physically and emotionally drained from the constant workplace and household tussle, which had a detrimental effect on their overall well-being. And many women in our consultation reported an increase in suicidal ideation. Participants also felt that culturally responsive physical and mental health services were not easily accessible and inclusive, with very few professionals trained to really engage with racialized immigrant women. Women reported feeling isolated. They also reported abuse by in-laws, financial abuse. The pandemic also exposed a critical lack of safe spaces like community centers for women to access when they were faced with instances of abuse and violence. In our survey, it was reported that 47% felt that severity of violence had increased during the pandemic, and 78% of the participants felt that the government did not do enough to address and prevent gender-based violence on both micro and macro levels. Due to shortage of time, I will just quickly go over the recommendations that we have. So it's important to recognize the important role of community-based organizations that foster help-seeking behavior because of cultural safety and familiarity. Again, it's important to focus on culturally competent, trauma-informed, and empathy-focused services that are easily accessible for women. Again, we want to highlight the need for low-income racialized voices to be amplified as part of the National Action Plan and work towards increasing access to shelters and safe spaces. So now I would like to pass it on to Mumtaz, and thank you so much for listening.